When we look at microbes, we have to take into account, well, they're everywhere. Not only are they everywhere, they're spreading to places that they're not, which I know is counterintuitive, but every surface has some bacteria, some fungi, something growing on it. New ones are coming in, other ones are dying off. So what we're going to talk about here in Chapter 9 is how to control this. We can't sterilize everything, but we have to come up with a way to clean, quote unquote, clean our environment. We see that there are four levels of different cleanliness, I guess is a way to put it. Sterilization, disinfection, decontamination, and antisepsis. What these are four different levels of quote-unquote clean. Some of these levels deal with inanimate objects like this table, or they deal with tissue. So when you look at these different levels, look above here. Sterilization. Sterilization sounds exactly what the word you think it means. Sterilize. To completely kill, completely destroy all microbes. Not only the vegetative cells, but any endospores that may be present. Disinfection, well, this is not quite to the level of sterilization. Here, whatever you're using, as you see the table above my head, could be bleach, iodine, heat. You're killing off the vegetative, the metabolically active bacterial cells, fungal cells, destroying most viruses. The thing is, this bleach, the iodine, the heat, they really don't do anything to endospores. So disinfection would be good for countertops, or if you're in a hospital setting, some of the medical equipment that's not going to be inserted into the patient. Decontamination, sanitization, this is getting rid of the big chunks. This is cleaning. You do this at home when you wipe down your countertops, with different types of detergent or dishwashing fluid, liquids, and things like that. You're basically removing large cells or clumps of cells, but individual cells that are adhered to the surface are unaffected. And then tissues on your skin and things like that. This is antisepsis. Different alcohol tinctures, or the surgical scrub stuff they use to clean the site for surgery. This is antiseptic. It's not damaging endospores in any way, but it is killing most vegetative cells, and because of the detergent that may be in the tinctures or in the scrub, it's loosening any bacteria that may be adherent to the surgical site surface. That way they can be rinsed away. So throughout this chapter, we're going to be looking at mechanisms or methods for controlling the growth or the presence of microorganisms. They're going to fall into three classes. Physical, don't want to use that finger, physical, chemical, and then mechanical.